Okay, so the first construct of the health belief model is perceived susceptibility. Young adults are typically aware of how contagious COVID-19 is. They may feel that they may have already had it, or if they haven't gotten it already, they may feel that they will get it, and they probably wouldn't be too concerned about it due to the fact that, yeah, COVID-19 has a high survival rate. So yeah, I'm pretty sure young adults are aware of just how contagious this disease is, especially considering the measures from the beginning of the year till now. COVID has spread so much, so many people are aware of how contagious COVID is. But that leads on to the perceived severity. Young adults may perceive the consequences of contracted COVID-19 to be negligible. They hardly consider the consequences of passing it to someone else. They have low chances because of the low chances of having a severe reaction. Young adults usually feel like COVID-19 won't be will be just a minor inconvenience to them due to the fact that the survival rate is so high, but they hardly ever considered that even though they may be asymptomatic, they still run the risk of passing it to someone else who may not be as who may not have as strong as an immune system as them. For example, they may pass it on to an older individual who probably would have never gotten it before if the young adult just took the same measures as older adults usually take when it comes to dealing with the disease and trying to prevent it. So, the perceived benefits that young people may view of taking COVID mitigation measures, they view that there's hardly any other benefits other than reducing the chances of contracting COVID 19, which they hardly perceive to be a threat due to the fact that it has such a high survival rate and they're in such a low risk group that it'll be there's hardly any benefit to them for them personally to actually take measures to prevent the disease. And the perceived barriers for when it comes to engaging in COVID 19 mitigation behaviors, they may feel like the mask that if they do manage to wear one, they may feel like it's difficult to breathe in the mask, even though like it hardly really affects your breathing. It's not, it may stifle it a bit, but it won't be to the point where it's noticeable. It has a significant change. And they may have trouble figuring out how to even access a mask. Surely they could like look it up online, but having like a mask right then and there, it may be difficult to actually have access to unless they were to create one themselves. And for the fear of missing out part, it part of the part of COVID-19 mitigation behaviors involve taking actions to stay away from large groups, meaning concerts are shut down, like public venues are shut down due to the due to businesses taking action to reduce the chances of people getting this disease. And so young people may feel like they're missing out in life or they're wasting their youth because of all these venues being closed and them not being able to like have fun in their youth. They view it as like what's the point of even taking measures and preventing the disease that I may get anyway despite the measures they take. And even if they do get it, they will hardly the chances of them going through a severe reaction is fairly slim. So they may view like, okay, what's the point? Why must I sacrifice my youth for something that will hardly even affect me?